Let's keep going with public health. When it comes to maternity benefits, the United States ranks at the bottom compared to other developed countries. Many young mothers don't have health insurance, and they're often forced to return to work just a few months after they give birth. Our correspondent Mary McCarthy has this report.
Yeah.
Rosie Shenk says she loves being a mother to 4-month-old Cruz. She works as a public health specialist, but even with her medical knowledge, she says that when she returned home after giving birth, she was completely overwhelmed.
You know, I have a hard time asking for help. How do I navigate? What are some tools I can use? You know, I haven't slept in a long time. I'm not thinking rationally. Can you just tell me that this is okay and that this is temporary and that this will pass? In the beginning, you know, he cried so much and he was so needy. I had to keep him constantly on me.
Rosie was recovering from a cesarean section that left her weak and unable to care for herself.
Someone to help me navigate the shower. I didn't realize how slippery my shower was until I got in there after a C-section. And, you know, just helpful things like that. My husband went to work right away. My mom was here and caring for me, but once mom left, you know, I would wait to take a shower until my husband got home because I was terrified of falling.
American women typically spend at most 2 days in the hospital after giving birth, and many of them return home to a precarious situation since the U.S. is the only developed nation without paid maternity leave. American women we spoke to said they needed not just greater financial support during and after pregnancy, but also greater emotional and logistical support. TARAH HOFFMAN says she experienced an unexpectedly difficult birth, after which she needed to hire at-home assistants.
Unfortunately, they are $35 to $40 an hour, and we had them come for between 4 and 8 hours a week in order to just get me some sleep. Really, that's what it is for me to be able to heal. Even with that, I was a wreck.
Exorbitant costs for at-home care, no guarantee of paid maternity leave. Even educated middle-class mothers like TARAH and Rosie say they weren't prepared for just how hard the first few months at home with baby were going to be.
I think even just a helpline where a mom could call and ask questions, whether it's with her care or her baby's care. But I mean, there were times where, is this normal? And I'd have to resort to the internet. And anytime you do that, you get scared out of your mind because you see the worst situations, of course, that are posted all over the internet. And so just some sort of reassuring, yes, this is normal. You know, you could call in, you could speak to a health professional and get your questions answered.
Good job.
Rosie says that despite the challenges, she knows she's lucky to have paid time off to spend with her baby. According to the Institute for Women's Policy Research, professional women like her are much more likely to have paid leave than low-income mothers.
All right.
Mary McCarthy for TELUSUR, Denver.
You feel that cool air?